Why marionette lines are so difficult to treat. Marionette lines are one of the most common concerns in aesthetic medicine. They are also one of the most difficult areas to treat successfully. Many patients point directly at the line beside the mouth and ask for filler in that exact location. Unfortunately, this often produces disappointing results. Because marionette lines are rarely caused by the line itself, they are usually the visible result of aging changes affecting the entire lower face. Understanding this anatomy is the difference between natural rejuvenation and an overfilled appearance. What are marionette lines? Marionette lines are structural, not simply wrinkles. Marionette lines are the folds that extend from the corners of the mouth towards the chin. They are named after traditional marionette puppets whose mouths opened and closed along similar lines. Unlike forehead lines or crow's feet, marionette lines are not primarily caused by muscle movement. They are structural changes. To understand why they form, we first need to understand how the lower face ages. Bone aging. Aging affects bone as well as skin. Most people think aging only affects the skin. In reality, the facial skeleton also changes with age. The maxilla slowly loses projection. The mandible becomes less defined. The chin gradually retrudes. As this bony support decreases, the overlying soft tissues lose their foundation. The lower face begins to collapse inward and downward. Fat aging. Volume loss and tissue descent change facial shape. Youthful faces have smooth transitions between facial regions. With aging, some fat compartments lose volume while others descend under gravity. The lower face gradually becomes heavier. This creates shadows around the mouth and contributes to marionette line formation. Marionette lines are therefore not simply skin folds. They are part of a much larger aging process. Note the anatomy of ligaments. Retaining ligaments remain fixed while tissues descend. The face contains retaining ligaments that anchor soft tissues to deeper structures. These ligaments remain relatively fixed throughout life. The surrounding tissues, however, continue to descend. Imagine a curtain hanging over a hook. The hook stays in the same position. The curtain slowly falls around it. The result is a fold. This is exactly what happens with marionette lines. The ligaments stay fixed. The tissues move. The fold becomes more visible. Why filler often fails. Treating the fold does not treat the cause. This explains one of the most common mistakes in lower face rejuvenation. Treating the fold rather than treating the cause. Adding filler directly into the crease may soften the shadow temporarily. The face becomes heavier. But if the real problem is heavy tissue above the line, adding more volume below it can make the lower face larger and heavier. Patients often describe looking puffy. Others feel they look wider. The line improves slightly. The face becomes heavier. Marionette lines rarely occur in isolation. As support is lost in the midface, tissues begin to descend. This contributes to jowl formation. As the jowls become heavier, marionette lines become more visible. At the same time, jawline definition gradually disappears. Eventually these aging changes extend into the neck. All of these changes are connected. This is why treating only the visible line often produces disappointing outcomes. Where treatment should begin. Experienced injectors assess the entire lower face. Experienced injectors rarely begin with the marionette line itself. Assessment usually starts higher. The lateral cheek provides support for the lower face. The jawline contributes to lower face structure. The chin provides projection and balance. Improving these areas may improve marionette lines indirectly. Only then should direct treatment of the marionette line be considered. Not every marionette line needs filler. The depressor anguli oris muscle pulls the corners of the mouth downward. In some patients this contributes significantly to a sad or tired appearance. Reducing its activity with botulinum toxin may improve the lower face. Some patients also have significant skin laxity, severe jowling or platysmal descent. In these patients, filler alone may provide limited improvement. Skin tightening procedures or surgery may be more appropriate options. The best injector is not the one who treats every line. It is the one who understands why the line developed in the first place. Because marionette lines are not simply wrinkles. They are the visible result of changes involving bone, fat, ligaments, muscle and skin. The goal is not to erase every line. The goal is to restore support, improve balance and maintain natural appearance. Because sometimes the best treatment for a marionette line is not treating the marionette line at all. For more evidence-based education in anatomy, injectables and cadaver dissection, subscribe to Dr. Ben Chan at ASI.